Hi, I'm Kerry Dolan. I'm an assistant managing editor at Forbes, and I'm here as part of Forbes' 2025 list of America's richest self-made women. I'm here with one of our newcomers. Sharing her story with us today, Maky Zanganeh, co-CEO and president of Summit Therapeutics. Maky, thank you so much for joining us.
Thank you very much for having me.
You started your life in Iran. You were born there, but you spent many of your formative years outside of Iran. How has that affected you and your life as an executive?
I was born in Iran, and that was the moment of the Shah regime, and it was really like a Western European country. But then after that, the revolution happened when I was 9 years old. And that was a moment that everything has changed completely. My parents, the both of them, they are architects, and all of the family is, into the engineering and medical doctors. And we were in Iran, and for sure, after revolutions, unexpected, a year after that, the war started. And
this is that Iran-Iraq war, right?
That was the Iran-Iraq war in 1980s, and I was around 10 years old. And for sure it was very, very difficult, especially the war started by south of Iran, and then over time, we got all of the rockets in Tehran, and that was the moment that we decided, my parents decided to get out of the country. But then finally, my mom was a very smart woman, she knew a travel agency, and they tried to get different flights getting out of Iran. So I was around 11 years old that I get out, and the only country that they give us a visa was Germany. So we came out to Germany, and I stayed in Germany, and I started my school in Germany. And my parents after that went back and forth, and my two sisters went in France. So that was the moment that we separated. The entire family was separated.
And then, so in Germany, you moved to Germany, you knew no German.
I didn't, yes.
And then your parents moved back, we're going back and forth. So who were you living with in Germany?
Actually, when I get to Germany, it was a friend of my father that actually helped us to get the visa. And I was living with them, with this family, for kind of 1-2 years. But Germany was nice. I love Germany. It just is, everything is black or white. Nothing is gray,
Well, especially after that chaotic time, under...
It was...
During the war in Iran, while you were there, you must have been afraid of bombs, rockets falling and getting...
A lot. And that is why sometimes right now when I look at, the television, you see the kids in Gaza, you see the kids in Israel, you get the kids in, Afghanistan, Syria, it is very tough. It is not easy. You're all of the times you're fearful what's going to happen. You see the families that they lost either their kids or their parents, or you come home, you see one of the building is already down. I mean,
you lived through that.
We lived through that.
Thank goodness you were able to get out of there. And then you went from Germany, you ended up going to university in France, of all places.
Yes.
How did that happen?
Again, that is my parents, because I finished my high school in Germany. I got applications for University of Heidelberg for going to do a medical school. But my dad came and said, no, you're going to France because I want that the family stay together. I just said, Dad, I just did my high school. I speak German. I got the best university application in medical school. Just said, no, you will go to France with the family. And for my parents' family is everything, everything.
So then did your dad have anything to do with you studying dentistry?
Yeah, that was my mom, actually.
That was your mom, okay.
Because actually I went to France, and my sister, one is in cardiologist, the other is gynecologist, the other one, she did endocrinology. So we were in the same university hospital and the same hospital. So, but my mom said, look at your sister, they are all of time in a night shift in a hospital, go get a profession that is easier, you will have a family and everything. I just said, okay, I will go to dentistry. So I went to dentistry. I had a very fun time in dentistry, but honestly, dentistry was not really for me. So I did all of the dentistry till one day, a friend of mine came and she was working with Computer Motion, and Computer Motion was a medical robotics company. So she came and Computer Motion wanted to have their subsidiary in France and in Strasbourg, because it was one of the biggest training facility for minimal invasive surgery was there, and is
For the company or just in general?
in general.
Okay.
In general,
At the medical school or
at
something?
yes, it was attached to medical school,
Okay.
but it's a private institution.
Mhm.
And I met this girl, her name was Mariam. She came to our home for it and just said, what are you doing? I just, I don't know. I'm in dentistry, you know. So you don't want to do something else? I said, of course I want to do something else. So I started to really learn about what they are doing, business. I went to my dad, my mom, look, I wanted to go to business. My dad said, no, you're not going. I said, Dad, I want to do really, you know, I want to learn something else. He just said, under one condition, you get your MBA. I said, Dad, seriously? So then that is where I started to get my MBA while I was starting to work with a company.
Part-time. So it was Computer Motion. It was your job with this robotic surgery company that you basically rose through the ranks, as I understand it. You started out in the training center in Strasbourg and then just kept getting promoted. And then you came to the US with that job, right?
Yeah.
What was that like? What was that
Actually,
transition?
that was Computer Motion was amazing. That was my first job into the business world and healthcare. And I really put my heart and soul into this company. And then after that as well, I met Bob about a year and a half, 2 years after that. Bob came to Europe.
And Bob is Bob Duggan.
Bob Duggan.
And he was the
He
CEO.
was, at the beginning, the investor, and then become the CEO and chairman of the board at Computer Motion. And when he came to Europe and he saw the entire facility, everything that we are doing, and he asked me if I want to run European country, you know, and Middle East. For sure, I look at Bob. I was 27 years old at this moment of time. I look at Bob. I just say, Bob, okay. He said one sentence that he stayed for the rest of my life. He just said, take a responsibility, the capacity would follow. And that was really the beginning, I can say, from professional perspective, from my personal life, you know. Once you take a responsibility, you do everything possible, you know, to make everything go right.
Because that's a young age to have responsibility for running basically Europe and Middle East for the country, for this company, right?
But that was really amazing moment for many. First of all, robotic surgery was a brand new concept in the surgical world. Robot in the operating room was not something that was familiar for the physicians.
So this would have been 1990s, late 1990s?
It was 1998, 99, 1999. I joined the company in late 97, 98.
Yeah.
And then after that, Computer Motion and Intuitive Surgical, they were both of them, I can't say in the competitions in the robotic world, you know. So, but we had a lot of success in Europe, and we went to the Middle East. And I remember me and Bob, we went to Dubai, we went to Saudi Arabia, Egypt, you know. And that was the moment that we really brought the robotic surgery into this world. We were the first to come in this country. Da Vinci later on, Intuitive Surgical follow, I can say follow us.
So you came to the United States for Computer Motion, then Computer Motion and Intuitive Surgical ended up merging, right?
Exact. Bob decided to merge the company, and he did it amazingly. I mean, one third of the Intuitive Surgical, we own that, and that was today's it's a $200 billion US market. And at this moment of time, I can say, when we merged, I was very sad. I was very sad because for me it was like it was like my baby, really Intuitive Computer Motion. And I remember one day Bob called me, just say, I want to see you outside of the company. I just, okay. Just said, we are going to merge. I fall apart. I said, Bob, no, I don't want that we merge with the Intuitive Surgical. But actually, retrospectively, it was the best one because the robotics, the concept of robotics stay. And if you really look at it now, even robotic surgery took over minimal invasive surgery. And that is really nice to see after 20 years that what robotic surgery can do, even minimal invasive surgery cannot do.
I had no idea that robotic surgery is more common now than...
And it is more common. It is some of the hospitals that they have over 10 robots in the hospital is fascinating to look at it. Yeah. So then, yes, and then after that, the CEO of Intuitive Surgical came. I was in in the office, and he asked me if I want to continue. And as I said, I was very young. I was my 32, 31 years old, and I just say to Lonnie Smith, no, I don't. He looked at me, why? I said, look, all of these years I fight for my product. I cannot go now. And I say, your product is better. It just is kind of from feeling and emotion, you know, because I really believed in our product, and our product was really an amazing product, you know. And now you're moving to a new company. It's not nice for me. Retrospectively, I love, by the way, I really have a lot of appreciation for Gary Guthart, the CEO of Intuitive Surgical. He is a top notch, and he brought robotics to the different level. But at this moment of time, I didn't know what that means, merger acquisitions and going to a new company, what's going to happen, you know, so I decided to not do that.
And that's the case with lots of mergers, right? There's nobody really knows is it going to work out? Is it going to be a good merger? Or is everyone from the old company, you know, are the two companies going to get along okay?
So and it's not the same, you know, power, the same way of making decisions, you know. So I decided to step back, and that was the moment as decided to go into learning more investment side of the company, you know.
So then you ended up working with Bob Duggan, looking at investments, which then led you
to Pharmacyclics. Exactly.
Your next adventure.
The next adventure. Pharmacyclics was really beautiful. And I can say at this moment of time, when I get out of Computer Motion, again, my dad say, oh, now you can go to dentistry. That's why I'm just saying, what? It's not finished yet.
Your dad still thought you could be a dentist after all that?
So I just said, okay, Dad, now you're winning the game. So I went to UCLA for residency for 3 months. I went to residency for aesthetic dentistry, where I really wanted to end up in aesthetic dentistry. But then I realized really dentistry is not for me. And then after that, at this moment of time, I just said no. And I called Bob, and I just said, look, I want to learn something different. And he just said, okay, then come work at the Duggan Investment. I was there, and we look at different company, a lot of different company. And so 100 companies, and Pharmacyclics really catch our eyes, you know.
And when you were looking at investments, so you had been in robotic surgery, were you specifically saying, let's focus now on drug development when you switched?
No, it was a lot of across industry for medical devices and everything. It was
all
there.
Healthcare?
All I can say, you know, my specialty is more healthcare, because that is what I can understand. Doesn't mean it was one moment of time we look on the different sector, but healthcare was something that I really love. But then in 2008, I decided to join Pharmacyclics, and 3 weeks after that, I called Bob, and I just said, Bob, it is not what we thought. And it was.
And at that point, Bob was just an investor?
Bob was a chairman of the.
He was the chairman.
Not chairman. He was a board member, and he was an investor at Pharmacyclics. And then Bob arrived on the 11th of September 2008 in the company. All of the board resigned, and that was the beginning of our journey in. At Pharmacyclics, and that is where we really started to start our phase 1 data and starting to enroll patients.
This is for the drug Imbruvica.
That is for the drug Imbruvica. Yeah. So we started, our first patient was in 28th of February 2009. By April, 3 months after that, the tumor shrank. And that was the moment.
This is in humans or in dogs?
In humans.
In humans.
Humans. Yeah. That was the moment that I can say it was the best moment for everybody in the company. So we raised money. We put the molecule into different indications. As you know, blood cancer has a different indications. You go to mantle cell, lymphoma, leukemia. But it's one drug, multiple opportunity. And I can say that was the beginning of the company. In 2011, we did our collaboration with Johnson & Johnson for $975 million US, and that was the moment that everybody wanted to have another BTK.
You became the belle of the ball, right, over those times. And then you fast forward to 2015.
2015, yes. We launched the product in November 2013. And then after that, in 2014, we decided to really sell the company. And from the moment that we decided to sell the company till we sold it was, I can say exactly 2.5 months. Yeah. We did a 21 billion transaction for half of the company.
$21 billion for half the company. And the motivation for selling, was it to be able to have the marketing and the power to get the drug out to the
That was
patients on
yeah.
a more effective
You know
way?
what? The speed of the company was huge. From
Yeah.
the moment for, I can say, the IND till the approval was exactly 4 years.
But you have, I mean, such an amazing story to invest in pharmacyclics, take a job there, realize it's got problems, have a drug that seems promising, take it through to approval, and then sell the company, and then after that, a few years after that, you had your own experience with cancer, right?
Yes.
I mean, tell us a little bit about that. How did that affect your thinking and your experience of working to develop cancer drugs?
You know, actually, after pharmaceutical, I just say, okay, that is a time I can be with my son and everything. It's very unfortunate. Is around October 2019, I feel really something strange, and I went to my sister. I just say, is something going on here, and she just said, let's do mammography. They did a mammography. They did a biopsy. It was at Christmas time. My dad was in hospital, and they brought me in the hospital. The surgery was on the 31st of New Year's. They did a surgery on me. So the both of us, we were in the same hospital, different department for different cancer. So, and that was the moment that I said, when cancer hit, your feeling is totally different. You know, always you think cancer or all of the catastrophic is for the others, is not, you know, when it's very unexpected.
You were stage 2?
I'm stage 2, yeah.
Yeah.
So, and then anyway, I started to do all of my treatment, but as Dr. Sledge is a president of ASCO, ex-president of ASCO, he was my patient. He just said, you were the worst patient that I ever had in my life. I did a side effect after side effect, side effect after side effect. So I was really, everything shut down, and I was really sick. I was really, really sick. And so anyway, I finished my radiotherapy, and at this moment of time, Bob again invest in a company, Summit Therapeutics. I always say God will never give you more that you cannot endure. But for other hand, I just say it was a good and a bad experience. You know, a good experience because now you have the experience of the patients. And I was talking about my sister because she helped me a lot along the way during my cancer therapy. We were talking last week, and it just say, you know, sometimes it's better that a patient die with hope, you know, with hope, and not just when you say to the patient, that's it.
Yeah.
And you
Sorry,
have
we
no
can't help
other,
you. Right. Yeah.
as the worst part, you know. Stage 3, 4, you have a different category of mindset as the frontline therapy, you know, and how you deal with the patients and what you can do for the patients. But as I said, it's in my life, my professional cancer therapy or everyday life, I say to myself, 2% chance is not 0%. You know, you have to fight till the end. And if we really can help one person, even for 1 month, the 1 month make a whole difference in patient life, because you never know. So that is why I believe the philosophy, fight till the end. Fight till the end, because you never know what is tomorrow. And perhaps tomorrow is another cure of cancer. You never know.
So Summit Therapeutics, that you and Bob are co-CEOs of now, it seems like it's a little bit of a similar story to Pharmacyclics. Like it was a public company when Bob invested in it, struggling, and then you've really turned things around.
Yeah.
Can you talk? I mean, do you see it that way? Do you see kind of a
We are specialized on that, I believe now.
Yeah.
People see us like that, you know, and I love it every time that people say, oh, they are lucky. But luck doesn't exist.
You're really on the road to having potentially a blockbuster cancer drug potentially be approved in the next, you know, year or two, which is, you know, unusual.
It is very unusual, but you know what? Sometimes, again, people think that is luck, but it's a lot of work. I mean, we have a great team. We have a great team at Pharmacyclics. We have a great team here at Summit. The top executive, they are honestly unmatchable, in my opinion, in the industry. Perhaps I have a little bit, you know, emotionally attached to each one of them.
Yeah.
But
so you joined Summit first in what role?
In November 2020, I joined Summit as a Chief Operating Officer. And that was Bob. The year before that, he joined as, he was a CEO and chairman of the board. And he invests in the company. And I had my cancer. I couldn't get to the company for all of this moment. And then when I joined, was November 2020. And actually, again, my dad said, are you going back after the cancer? What do you want? I just said, Dad, I have my mission. I have to go back. I went to Bob and I said, Bob, either we play big or we never play. Because after my cancer, it was not even a time to just be, oh, good to work in this company, you know? So when we joined, the team came and Bob and I were talking together to just see what we can do. And we just said, let's move the direction of the company from an antibiotic to the oncology. And at the same time, when we look at our data, we were actually, retinazole was a very, very great product, you know.
Your antibiotic,
a lot.
yeah.
But the data was not, was equivalent of vancomycin. And it was very difficult to put another hundreds of million to just prove it differently. So at this moment of time, the team and Dave Ganskard, I call him Dave G, it's easier. He led the team to look at after different molecule, you know, and for 1 year, the entire group, they were looking at the molecule to see, to evaluate different companies. And
did you give them a mandate to go globally? You know, any country? Europe?
The mandate was globally. They will look at every country, but they will look at an oncology product, not hemato-oncology, solid tumors, and late stage. So that was the 5 things that we wanted to have. Because as I said, if we would have early stage, all of these team members, they were not really.
That wasn't their focus.
Yeah, that was not their focus.
For people who might not know what bispecific means, like talk a little bit about the mechanism of
in a very easy way, ivonescimab is a bispecific antibody, has a 2 mechanism of action. One part of it is kind of immunotherapy, means that the immune system will kill the cancer. The other part is that you are cutting all of the nutrition and you're starving the cancer by cutting all of this blood supply. That is really the easiest way to talk about this bispecific.
So the bispecific is sort of going at the cancer 2 different ways.
In a 2 different way. And that is how they are killing the cancer.
And are there any approved bispecific drugs so far? I mean,
not equivalent for ivonescimab that we have on PD-1 and VEGF inhibitor. Is one of the bispecific of Akeso is approved in China, and ivonescimab is approved in China, but not the rest of the world.
So ivonescimab is the name of the drug that you licensed from Akeso.
Exactly.
So, you know, if all goes well and it gets approved, then it's going to be a new kind of cancer drug, essentially.
Exact.
It's really pushing the cancer treatment to the next level.
Exact. Actually, when we got ivonescimab, the team, they worked in, it was the whole summer 2022. And we after that, what we did, we started to do our deal with Akeso, which was, again, a company with a 250 million market cap. It did a deal of 5 billion. And again, I give Bob a lot of credit in this regard.
But the 5 billion works, you give them a certain amount of that up front.
500 million up front, and the rest 4.5 billion as the entire
milestone
all
the things,
is once we get to the approval and commercializations. And at this moment of time, the company was at 250 million market cap. And again, everybody say, oh my God, what you guys you're going to do and why you're doing that. It's a molecule from China. And previous of that, 2 of the big pharmaceutical companies that they tried to get the molecule, they failed on their product. So it was, again, skeptics.
Right. You're trying something that's failed with others. Why are you taking this risk? Of course, now, right, you have you're not the only U.S. biotech company that's licensed from China.
Exactly.
So
at this moment,
it's kind of a trend right now, right?
Oh, totally. At this moment of time, we call our investors. Nobody wanted to put money, and then Bob again put a huge amount of money behind the company. So I believe I have around 700, 800 million. And as always, he just say, Maky, you put money? I just, okay, I would. At this one, I put a lot of money as well in this company.
Because you came out of the pharmaceutical sale to AbbVie with a much bigger sum. Now, with you owning just under 5% of Summit, the stock has gone through the roof because investors are very hopeful that you're going to have a winner with this, you know, you're going to be able to treat lots of people with this drug if it gets approved. You are now a billionaire. What is that like?
It's for sure, you know what, it's nice. It's nice to be in this level of billionaires, but not that I expected to be, but it just is, you know, you see a lot of things along the way. But you know, the true story is where I am. I love it where I am. I learned a lot along the way. I experienced a lot. And this company, opposite than many other company, I don't know why, I'm very relaxed. You know, I'm not stressed. Oh my God, that's happened, this happened, you know. And along the way, when you have a success, for sure, the money follow. But I'm very happy where I am right now.
Yeah, but I would imagine what gets you up every day is the end result of being able to get a drug passed, approved by the FDA that can help cancer patients rather than making more money. I mean, I'm sure the money is fine.
Yeah, I don't know because we are working at a cancer and cancer therapy or this type of company, but I see a lot of cancer patients. I mean, left and right, I'm hearing people text messaging us or emailing us, can you help us with this? Can you help us with that? The cancer suddenly has changed. If before was an older age, now is more and more and more. I mean, look at colon cancer is between 20 and 30. Even pancreatic cancer is coming much earlier time than now. You know, breast cancer, from every 8 women, 1 has a breast cancer. Now you're asking yourself, what's happening around us, you know, and that is the moment then, and especially, as I said, the lung cancer, breast cancer, all of them, colon cancer, they are not easy to treat. We are far, far from the cure.
And lung cancer is hard to diagnose, particularly in non-smokers, right?
Exactly.
Because non-smokers do get lung cancer sometimes.
Exactly. Lung cancer is difficult, pancreatic is difficult, colon cancer, each one of them is not, as I said, like a blood cancer. And is for sure is very gratifying that you know that at minimum our drug right now, and that was the result of last September's, and even the drug got approval last week in China, when we went head to head against Keytruda, you know, we can, the progression-free survival, which is the time that the patient at minimum 1 million is 5 months. 5 months is a lot.
Yeah,
it's not
5 months.
Extra 5
so
months.
Keytruda is Merck's big drug.
Yes,
That's
$30 billion
kind of the big kahuna in cancer care.
Is a king
that
of
you're,
the king.
yeah, that you're competing against, and analysts are predicting that your drug could outperform Keytruda, and you're going to be doing trials.
We are right now. We are doing a lot of phase 3 with our AKSO, our partners. They are right now around more than 25 phase 1, phase 2, phase 3 going on, and on the phase 3 we are roughly around 10 phase 3 going on right now in with this drug.
Could we expect results that you could then send to the FDA? You could apply for the FDA next year sometime?
I mean, publicly we announced that sometimes end of the year we can file our FDA filing, but then we are expecting sometimes around late 2026 beginning to have the product in the market.
Right.
But at this point we are working based on the data, how everything is going to be. But our drug got FDA authorization in China, and they are selling it right now for 2 indications. We just finished our EGFR mutant for the lung cancer, but the frontline study, they all ongoing right now for the next 2 years.
So you shared some happy news. You and Bob, your co-CEO, got married in December. How does that affect your working relationship?
Actually, you know, me and Bob, we always work together very nicely, and is I can say in the company or in the business, the both of us, we know where we are going, how we are working together, how we're working with the team. Is for sure when you come home, you're still talking about the business. And Sean, my son, is the same approach as well. So the 3 of us, we are very, very compatible together, but we have a lot of fun on working together and being in the private life.
Well, clearly you and Bob are very passionate about your work. It certainly comes through. I wish you the best, and thank you so much for your time, Maky.
Thank you so much, Kerry. Really appreciate it. Thanks.